Sanskrit, English, Telugu, Hindi, Kannada, Tulu, and Tamil. And sir is completed his BAMS degree during 1999 from esteemed college which is there in Karnataka, that is SDM College of Ayurveda, Udupi. And also, sir completed his MD in Shastra in 2004 from the same institution, that is STM College of Ayurveda, Udupi. Sir also interested in many extracurricular and other knowledge gaining degrees also. Sir in this one completed clinical nutrition CCN in 2007 by VLCC New Delhi. Sir completed CCH Pediatrics 2010 Institute of Health Science Mumbai, and CGO Gynecology and Obstetric in 2010 Institute of Health Science Mumbai. Geology, now sir is also doing course in geology under Andrew Eldin from New York. Sir is also doing course in chemistry under Anin Marine, New York. Sir is a Vaidya, that is especially Rasa Vaidya, associated with various projects and experiences. He got a rich experience in SDM pharmacy. Sir has guided so many students under his able guideship, and also sir is worked under eminent personality in the field of Shastra, that is Siddhinandan Mishra sir, and he is author of more than 27 textbooks in the field of Ayurveda and Shastra. And sir is the he has published so many papers, and he has translated the books and also helped in translating the books to Hindi along with Professor Siddhinandan Mishra sir. Especially some of the books, what I can name is here Ananda Kanda, which was there in Sanskrit, he translated it to Hindi, and also Rasaratnakara, okay, which was there in Talapatra of Telugu. Then sir has translated it to Hindi and Sanskrit, and Chikitsa Paddhati from Telugu. That was also in Sanskrit. It was translated. Okay, sir is having a very rich experience in teaching PGs and undergraduate students, and also sir conducts various classes uh, for the for the PGs and learners of Ayurveda and Shastra, and he is having very rich clinical experience in treating very complicated diseases, and he is well known to treat such type of diseases in okay, especially in by using Rasoshadis. Okay, and the sir also conducts field survey at Kerala, Trivandrum, okay, in Andhra Pradesh and in some parts of Karnataka and Srisailam. So many he has a habit of collecting so many rare books in his personal library, and also rare drugs which are there explained in Rasashastra, Rasaushadis. He is collecting, and also he is doing research on such type of Rasaushadis. Especially in Pottali Rasayana, he himself prepares various types of Pottalis and uses it to the personally as well as to the patients also. He is doing so much of researches and publications, everything. Now I request our beloved Dr. Gopinath sir, Gopi Krishna sir, to present his views in this particular seminar. Thank you so much, sir. I
Thank you,
welcome
Dr.
Gopi
Vikram
Krishna
sir.
sir. Yes.
Now I actually welcome to Dr. Gopi Krishna sir to now the session. So now the session is to over to Dr. Gopi Krishna sir. Thank you.
Yeah, thank you very much.
Is there any problem, Dr. Gopi Krishna? Just now your presentation was shared. Yes. Yes. Yes, you can convert to slideshow.
ಸ್ಲೈಡ್ ಫುಲ್ ಸ್ಲೈಡ್ ಮಾಡ್ಕೊಳ್ಳಿ ಸರ್.
Slideshow, yes, yes,
ಆಡಿಯೋ ಬರ್ತಾ ಇಲ್ಲ.
yes. Hariyo.
ಮಾತಾಡಿ ನೋಡ.
Who is there?
ಮಾತಾಡಿ ಸರ್.
Now it is clear.
ಈಗ ಇಲ್ಲ, ಹಿಂಗೆ ಲೈನಲ್ಲೇ ಮಾತಾಡ್ಬಿಡಿ. ನಾನು ಲೈನಲ್ಲೇ ಇಟ್ಕೊಂಡಿದ್ದೀನಿ, ತೊಂದರೆ ಇಲ್ಲ. ಮಾತಾಡಿ ಸರ್. ಸರ್, ಇಸ್ ಇಟ್ ಆಡಿಬಲ್?
Yes, clear.
ಕ್ಲಿಯರ್ ಇದೆ, ಮಾಡಿ ಸರ್. ಇದನ್ನು ಫುಲ್ ಸ್ಕ್ರೀನ್ ಮಾಡ್ಕೊಳ್ಳಿ ಸರ್ ನೀವು.
Yes, full screen slide.
ಓಕೆ ಸರ್, ಡನ್. ಸ್ಟಾರ್ಟ್ ಮಾಡಿ ಸರ್.
All the best, doctor.
ಈಗ ನೀವು ಮೊಬೈಲ್ ಆನಲ್ಲೇ ಇಟ್ಕೊಳ್ಳಿ. ನನ್ನ ಮೊಬೈಲ್ ಇಂದಾನೆ ಇಲ್ಲಿ ಆಡಿಯೋ ಕೇಳಿಸ್ತಾ ಇದ್ದೀನಿ. ಓಕೆ, ಡನ್.
Thank you very much for I'm trying my best to see that if at all I can manage to go up with the concept of the Pottali Kalpana. I'd like to acknowledge with Pawan Sharma sir, Vikram sir, and as well as the most sacred Guru, Shankar sir. It's really a great opportunity for me to discuss many of these aspects which is specifically related to that of the Pottali Kalpana. This is one such treatment protocol which is very significantly been untold, or possibly it's not totally well evident. That is the reason why the treatment modalities have really lost in its methods of treatments. So on that grounds, it is
It's always
said to be. It is always said to be having a significant phenomenon for understanding the Pottali Kalpanas right from the classical texts. So on that grounds, we'll try to understand what all the details we need for understanding it in a.
मैं ज्वाइन तो हूँ लेकिन मैं देख नहीं पा रहा हूँ. मैं ज्वाइन तो हो चुका हूँ. मुझे गोपी कृष्ण का
बोलिए मत बोलो, म्यूट करके बोलिए.
म्यूट किया.
So before we start with this particular session, I would like to give the salutation to the Lord Mrityunjaya, who is the chief component for making the situation to understand the whole of the Rasa Shastra. He is the God who is responsible for the life and death. He is a person who is responsible for the things to happen in this department. He is a person to make. With his blessings is the one what we are going to learn today in the form of the Pottali Kalpana. So basically to speak, what are the Pottali Kalpas and why do we need them? Clinical significance of the Pottali Kalpas. So these are the few things which we'll try to understand or analyze in next possibly another 1.5 hour. We'll try to see what the things speak experiences in dealing with that of the Pottali Kalpanas happen to us. What does the history speaks about? Whether the history says a lot about the Pottali Kalpanas, whether it is praiseworthy to go with this sacred preparations like that of the Pottali Kalpanas. So on that grounds, an attempt was being made to survey into the books and try to understand if at all we can really go with the Pottali Kalpanas. And based on that, we can come to know there are many references which are being lived from the textbooks of 8th century onwards, from the Rasaratnakara, Rasarnava onwards, which makes the whole of the scenario, the whole event of the Pottali Kalpana. The Pottali Kalpana is the uniform for the Rasa preparation, or very secret for manufacturing, the pharmaceutical process, and as well as for the clinical presentation. To speak about the reference, विस्तारितस्य वस्तूनाम् अल्पीभवति pottam pottal iti grinhati iti pottali. So the pottali is a one which can be defined as the collected scattered materials into
Hello. Hello. Gopi Krishna ji, you are mute. Please unmute yourself. Your presentation is viewing.
yeah. So very much to see that the particles which are being scattered in the pharmaceutical processing are being combined together or being said to have their efficacy in a complex mixtures, in a new compounds which has been prepared in the name of Pottali Kalpanas. So because of this particular reason, the materials which are being scattered or united in a chemical composition which made this compound a new set of treatment modalities. When we look at textbook, we can come across nearly 70 Pottalis, and on analysis, there are some repetitions with small alterations, and approximately comes to nearly 40. There are nearly 40 preparations, and most of them, at least 20-25, we are commonly using in our clinical practice. And routine being taken into clinical study. The extent of the Pottali practice starts from a simple case as the rhinitis, fever, or related disorders of either of the issues. It's a chronic one or acute management. So, what is the necessity of the Pottali Kalpana? What is the use of taking this into the administration? So, for that, an attempt was been made to see what are the reasons given in the textbook. The textbook speaks about few things like the convenience and the enhancement of the property. These are the two common things which the textbook speaks about for the utility of the Pottali Kalpanas. And the convenience, because the Vaidyas used to travel from one place to another place, and during this process, the possibility of the breakage and the medicines might be mixed up. This problem is not seen in the Pottali Kalpana, which made it more popular once upon a time. But now it's not like that. The combination of drugs which has been scattered in a particular composition is being united in a different molecule so that it gives an instant and a better result. So along with convenience, it is also the efficacy of the drug, which makes it more and more potent. So why the enhancement of the property is the play of the Gandhaka? Is one such material which has been an essential component in most of the Pottali preparations, which makes the preparation into a very unique way of enhanced property. Why this happens, we'll come across eventually. So when we read the Gandhaka from the various textbooks like that of the Rasaratna Samuchaya and all, we come to a few of the references there wherein been explained. Like these are the references from the Rasaratna Samuchaya. I would not like to go with all the shlokas. Do refer them as per the reference. But few things which are concerned for us for the Pottali Kalpana is being specified here, which is Ayurveda is a concept of samskaram gunakaranam. Here in Pottali preparations, the material or the medicine is being boiled or it is being totally inside the gandhaka, dravita gandhaka. So the samskaram gunakaradhanam, the qualities of the gandhaka are being attributed to the prime drug in the form of amon mochana shoshana, which removes the ama, which removes the disease, vishaha, it removes the toxins, sutendra virya prabhu, which energizes mercury. So these are some of the advantages. Another reference from shloka number 48, it speaks about mrityu jaradikan. So it is better if you take or consume the Pottali Kalpanas, which can ward you off from the mrityu or jara. Jara is the geriatric or the debilitated conditions, wherein you need to consume more and more of these drugs. So enhancement of the property, specifically whenever we're using with that of the Gandhaka, it is for the fixation of the mercury there, making it more therapeutically efficacious and also make it to be an emergency medicine, which makes it more and more potent. This is it in a nutshell to speak about its convenience in transportation. It is used easy in administration, dose fixation, preservation of the properties, and in case of emergency medicine. But I am using it in my clinical practice, at least to 70 to 80% of the patients in routine sector. In its pediatric case, either gynec and obstetric, geriatric, or in general conditions. So what are the various zones wherever we are taking in the clinical perspective? Will be few of the further discussions. So this, we are preparing the Pottali Kalpana. I have brought this into the slides just because of the reason it's new for few of the people, the method of the preparation. So on that grounds, Shodhita has been sprinkled over that. The referred drug is being kept in between and it is being wrapped over silk cloth like this, and it is being immersed into the molten salt. The Gandhaka is made to melt, and once it is being totally melted, then we are converting it into the preparation by immersing the Pottali Kalpana. Later on, once you attain the Paka Lakshana, we are removing it out, do the Rasa Pujana, and it is being administered to the patient. Then later on, there are few of the things which you need to consider during the preparation of the Pottali Kalpana. The ingredients which are being set from the textbook, the binding agent, the Swarasa or the Bhavana Dravyas, like might be it is aloe vera or isabgol or any of the Babula Swarasas. Shape of the Pottali, drying of the Pottali, containers, cloth, Paka Kala, Paka Lakshana, Paschat Karma. So the ingredients very commonly used are the medium gold, which is very common ingredient in almost all the Pottali Kalpanas, which is said to be most sacred and the most clinically effective drugs used in Rasa Shastra, or the essential components in most of the Pottali Kalpanas. The next is about the aloe vera. Few of the textbooks have claimed even about the isabgol or babula or tulsi swarasa, chitraka, etc. Shape of the Pottalis, shapes are being prescribed for the textbook. Containers, usually the earthen pots are being taken. I just run over the slides. The silk cloth has been selected nearly to 4 layers, and it has been used for the pharmaceutical processing. Quantity of the sulfur, quantity sufficient can be taken, which is very ideal for the prescriptions. Agni, indirect form of a mandagni is required. Pakakala as Pakalakshana, till you attain the Vyoma Varna in the sulfur. Pakalakshana, you have the Vyoma Varna, Neela Shyama Varna, you get a resonant sound when you hit it with a spoon or a metallic content. It breaks down into the sulfur vessel by burning the cloth. The Paschat Karma, remove the Pottali, polish it with a knife, and it is being used once it turns to the room temperature. Few of the alterations been done during the preparation? What are few operations which has been done there? So, alteration which has been done, or something like where we have used the Kasisa, which is not as per the protocol of the Pottali Kalpana. We have not prepared it as per the textbook. The advanced method, like where we have used it on the clinical trials, it is exclusively useful in case if we are adding Kasisa into your Pottalis, by which you get a very good antioxidant property, very quick response in the patient, becomes more homologous to the patient's body. The next thing what we are trying to do is, for increasing the Rasayana property, we are using the Makshika Sattva or Abraka Sattva as an ingredient in the Pottali Kalpana, which makes it more and more potent. Polymerization is a secret why the sulfur is being used, or the Ashta Samskarita Bharata or Shatguna Jarita Gandhaka is being used in the Pottali Kalpanas. Similarly, the Tivrata and the Bhoksha of the Pottali depends in case if you treat the mercury with Haratana and Manashila, make it Bhokshita so that it becomes more effective in the clinical trials, gives very quick response in the patient. Only thing is, you are not supposed to use excessive of Haratana and Manashila preparations in case if the patient is with Pitta Prakriti or Pitta Vikruti. Rest of the patients, this makes wonders. Any of the formulations can be made into the Pottali. Usually, like I make the Pottali of the Kumar Kalyana Rasa, I make it of Ananda Bhairava Rasa, Chandrakala Rasa, Raja Pravartini, Sutta Shekara, Vasanta Kusmakara, even the Jai Mangal. I have used the Jai Mangala Pottali in lots of many of the COVID cases. So this is how you can make the Pottali Kalpana with various compositions, where it can be used in so many conditions. So herein I brought an example because these are the trials which is made by we people. It's not from the textbook like Kumar Kalyana Pottali, Ananda Pottali. So whether we are in a right track, so in an emergency condition, like we had a bilateral intraventricular bleeding in a brain of a neonate of age of 4 days, possibly a birth injury, we have given the Kumar Kalyana Pottali in the form of a oral administration as well as per rectum in the form of an enema. See the response in the child. The size of the hematoma was nearly 9 into 7 mm, bleeding from the right horn, and later on it has started to evaluate. The child had all the symptoms of paralysis. It was being advised for going for a craniotomy and a surgery, which was not been a wish from the parents because they were not affordable and they were very sick to give away their child of 4 days for the craniotomy. So on that grounds, we have given them with that of the Kumar Kalyana Pottali. You can see the hematoma, how it started to decrease eventually. You can see the size of hematoma, which is coming down. Day by day, it has started to become hypoechoic. It's more organized from the previous report. And eventually it started to decrease. The size of the hematoma is smaller and smaller. You can see the impression that bilateral intraventricular bleed appears slightly smaller and more hypoechoic. And later on it becomes more and more smaller. Size of the hematoma turned from 8.5 to 2 cc. It's a small thing. And it has further reduced. And the child is not paralyzed. Without craniotomy, we could treat the patient. Now, the size 0.5 and 1.8 cc, which is highly negligible. And the child was normal and survived, which is more important. And we could really make this patient to become normal, and the patient is alive even today. So this is how organized with that of the Kalpanas. Similarly, it is something about once the Pottali is being prepared, we go for the Rasa Pujana. We try to see if what all we can manage it with treatments which is being done by Masuri Modi on the water crystals, which you can see on the YouTube. So similarly, we try to offer, because Rasa Shastra speaks about offering prayers to the medicines. So we offer the prayers to the medicines. This, all my presentations will be of these kinds, and give it to the patient. Bhavana and Anupana.
It's unmuted.
म्यूट नहीं
We can
करना
give Madhu, Brita,
आवाज आ
whatever
रही
you
है
find it's feasible for the patient's condition. Scrape the Pottali and never hammer it. This is what the specifically the theory of the bioinformatics speaks about. Never the Pottali should be pulverized. Never make it into a powder by hammering it. Always try to scrape it over a street plate or a kitchen slab or over a steel plate even. Clean surface with and roll it and then give it to the patient. Never crush it and give it to the patient. It will be of no effect. So once you give it in this particular way, it has given enormous response in the patient. The textbook speaks about this reference from Ananda, wherein he speaks about Sir Rasa Kamate Dehe Siddhaya Sambhavanti Rasayane tu ya prokta Mulika Deha Siddhidaha. So at least if you make a herbo-mineral mixture of these, it is sufficient to make a Deha Siddhi. This is what required for us. We want to attain the Deha Siddhi in our patients. So that is the reason why we have prepared this Pottali Kalpanas. Anyway, if not for the publication, an attempt was being made to convert the Hemagarbha Pottali into the molecular docking and try to see if at all it can act in the patient suffering from cerebrovascular accidents or the brain receptors. So it is something like the DNA or the RNA, the protein content or the amino acids which has been injured during the illness of an individual is being repaired by the power of the substances like this. The medicines which we give in the form of Pottali Kalpanas can heal up to the level of the genetics or the RNA and the DNA. Which has been evident. As you can see here, the Hemagarbha Pottali Nirmana. This is how we have prepared the Hemagarbha Pottali, and it was being given to the trial with the bioinformatics in the molecular docking. You can see the molecule, how it has been bound to the brain receptor protein. And it is so effective with a less amount of energy required, it can show the therapeutic response in the patient, which is very, very, very significant. This is the importance of Hemagarbha Pottali. Hemagarbha Pottali, the chief component is the gold, where we are using huge quantities of gold for making this preparation and trying to use it in our clinical trials. We are using at least around 17 to 20 very common use of Pottalis in our practice. Of course, there are up to 40 which we use based on the requirement. Whenever we require it, we try to prepare it and use it in our patients. But in most of the times, I am using Hemagarbha in a very common phenomenon in most of my patients. The route of drug administration, how Pottali can be given. I am using Pottalis in the form of kavala. I scrape the Pottalis, I mix it with tailas, kashayams or anything, and ask the patient to do the kavala or gandusha, especially in the patients who are suffering from the disorders of the oral cavity, especially oral ulcers, or in case you are having some malignancies of the oral cavity, like you have the squamous cell carcinoma of the tongue or the oral cavity or adenocarcinoma or any of such conditions. We are giving this Pottalis in the form of a local application, in the form of kavala or gandusha. We are giving it in the form of an, as you see from the Shwasakudhara Rasa. Of course, the quantity here is very, very less. Extensively, we are using this Pottali Kalpanas as a Lepa Kalpana. We are using the scraping the Pottalis and we are using it on the malignant ulcers, not healing wounds and ulcers, especially the necrotized areas. We are trying to see if at all we can resonate with local action. Through the endoscope, we are using the Pottalis and we are spraying on the affected areas in the gut, like you have the malignancies in the stomach, esophagus, or might be it is peptic ulcers or gastric ulcers or any of such conditions. We take the Pottalis in the form of a liquids and we are spraying it through the endoscope instrument over the affected area. For observing a tremendous response, just like you do the Kshara Karma in the Arshas patient, you find Arshas being immediately resolved. Similarly, is even by of this Pottali Kalpanas on the affected area will totally resolve the ulcers or totally resolve the malignancies of the GIT. Through the colonoscope, we are giving the applications in the form of enema. Or we are giving in the form of enemas. especially in ulcerative colitis patients or in malignancy. So this is very much possible, as you can see here, as Kavala and Gandusha, especially the Tamragarbha is being given to the patient to suppress the squamous cell carcinoma of the oral cavity. Here you can see the pyriform fossa having the malignancies, which is being treated well by the application of the Tamragarbha in affected area, by which literally the malignant cells are sloughed off and the patient is survived. And the normal cells are not been affected. Only the abnormal cells were being killed by doing this procedure. Of course, we have taken the support of a laryngoscope for the application. This is a case of CA breast, of course, with some metastasis all over. And this is a report of the patient, wherein this tumor is seen and it has caused huge ulcerations on the breast area, wherein the patient was being applied with the Pottali Kalpana to reduce the ulcers, because it's usually a painful phenomenon in the patients who are suffering from CA breast because of the bony cage. The ribs are also being involved and it causes huge ulcerations there. It was an invasive duct cell carcinoma. The label for the malignant ulcers was being given and a tremendous response was being observed in the patient. See the size of the ulcers there over breast region, and they have been eventually shrinked by the application of the Pottali Kalpanas. They are drying off and it becomes normal. So this benefits we can get. This is a case of squamous cell carcinoma. You can see literally the squamous cell carcinoma, the cells being necrotized by the application of the Pottali Kalpanas, by which the wound starts to repair in a healthier form. So these benefits can definitely be done in most of the patients wherever you go for this. And these are not innovative ideas. When I speak about application of Pottali Kalpana, I try to the benefit being taught to me by Acharya Sushruta, where he speaks about the Shashtupakarmas in the Vrana chapter, where he takes so many methods of treating the Vrana. Among that, the Lepa Kalpana, Dhupa Kalpana, everything are being given for the ulcers or the Vrana, Dushta Vrana. So similar techniques I have adopted with the Rasoshalis, that also specific with that of the Pottali Kalpanas, and we have tried to use it in our patients. As a first way in case of ulcerative proctitis, Pramana or sometimes it is very, very useful in such conditions. The response which you can observe here of the patient, where you can see the ulcerative proctitis within short period. The age of the patient is only 9 years. You can see the before treatment and after treatment report of the same patient who have responded tremendously by the administration of the Pottali in the form of an enema in ulcerative proctitis case. Similarly, we have also treated the patients like that of the ulcerative colitis. Similarly, what we do, we are applying the Tamragarbha Pottali in the form of Kshara from the Sampradaya, use it in the fistula and in arshas. By that, it happens, the response of the patient is very quick. Wherein we are able to see the fistulas and the arshas being treated a tremendous. So these are the various forums or the modules wherein we can use the Pottali Kalpanas in our clinical practice. Similarly, let us try to use other Pottali Kalpanas which we are using in our routine practice. The thing is about the Lohagarbha Pottali, which is seen in the center in the form of a Lingakara. As I said, all my preparations are being offered prayers like this, and then it has been given to the patient for dispensing. So herein the Lohagarbha Pottali very specifically being prescribed to the patients suffering from. As per the textbook, it is the Sangrahani, Pandu, Kamala, Raktakshoba, Prameha, Pradhara and Netra Roga. But I am using it in my clinical practice in most of the patients who are suffering from the disorders of the Rasa and Raktavashrotas. Also in the patients like the malignancies where you have the spread of the illness through the blood, because the Raktakshoba is the indication as per the textbook. So this is how we are using this particular Pottali in our patients. Mallagarbha Pottali is another prescription which is being given by the textbook. So this particular Mallagarbha Pottali is being used extensively in the patients who are suffering from the disorders of the Vata and Kapha. Very specifically the one wherever you have the Shroto Sangha. pathologies. By the textbook speaks about the indications of the Mallagarbha Pottali as the Jwara, Shleshma Vata Vyadhi, that is Kapha and Vata, Upadamsha, Firanga, Bagandhara, Nadi Vrana, Shwasa and Agdimandya. So these are the various clinical conditions as per the textbook. But we are using it almost all the clinical pathologies, whichever is related to Vata and Kapha. Be very cautious in using this particular drug in Pitta Prakriti people because it is Gauri Pashana. The prime component is Gauri Pashana. So you should be cautious in case if you are using it with the Pitta Prakriti or Pitta Vikruti patients. Another prescription wherein we are extensively using this particular composition in many of the patients who are suffering again from the disorders of the Vata and Kapha. Very specifically, we are using it in the chronic disorders, especially wherever you have sclerosis, especially the conditions wherein the disease is being turned out of its control. It has shown some atrophic changes in the body. In those conditions, we are using Tamragarbha. Textbook of Kapholbanada Tridoshaja, Shwasa, Kasa, Jwara, Shula, and Vardhakya Shosha. Beauty of the Tamragarbha is it is essential to remove the purulent discharges related to that of the Kapholbana Tridoshaja. In all spread illnesses and also from the infective zones, you have any of the infections. In all the infective zones, we are using this particular component very extensively. The next one is about the Rajatagarbha. Very extensively, which we are using in most of the patients suffering the disorders which has been related to the female reproductive organs are also related to the Upadhatus of either of the Shrotas. Having the efficacy of the Garbhashaya Shodhana and also it is having the efficacy of Rasayana and Vata Shamana. It is also a Saumya Dravya and it also been used in the conditions of Pitta. The textbook speaks about clinical indications of the Rajatagarbha Pottali as indicated in the Prameha, Shukradosha, Pitta Vikruti and Muvyadis. So these are the various conditions where it can be used exclusively. The Vishagarbha Pottali is a combination of Marathala, Manashil and Gauri Pashana, which is exclusively used in the conditions wherever you would like to arrest the metastasis in the patient. Of the illness or spread infections through the blood, you need to arrest it, then use Vishagarbha Pottali. It is exclusively useful in the patients suffering from the spread of the disease. The textbook is about the indications as Upadamsha, Viranga, Vatavyadi, Shidata, Shleshmaja Vikara, Raktadosha, Bagandhara, Kushta and Nadi Vrana. It is very specifically indicated in all the infective pathologies. Be cautious again because it's arsenic compound. Don't give it in high concentrations for the people suffering from Pitta Prakriti or Pitta Vikruti. Sridhatu Garbhali is another description which is being given from the textbooks. It is extensively useful in the conditions of the teratological complications, the congenital disorders, the birth deficits, the disorders of the stubborn illnesses, the deep-rooted illnesses, Bahudoshavastha. In all those conditions, we are prescribing them with that of the Tridhatu Garbha. The textbook speaks about the indications as a Prameha, Utimeha, Pradhara, Shukradosha, Shukradi Dhatu Vardhanam. In all these conditions, we are using the Tridhatu Garbha Pottali. So these are few indications which we are trying to utilize in the various zones of the Pottali Kalpanas. Shilagarbha is a miniature of that of the Mallagarbha. You have three categories of those kinds. One thing is Mallagarbha, Shilagarbha and Talagarbha. All three are arsenic forms. But Sadatama Bhava, because the concentration of arsenic is very high in Mallagarbha, it's moderate in Shilagarbha and comparatively a bit less in Talagarbha. So based on that, the Taratama Bhavas in the patients, try to use it. The textbook speaks about the utility of Shilagarbha in conditions like Jwara, Shwasa and Kasa are the patients. The Prabha extensively used for conditions of the Bala, Ruddra, Sukumara, Stri, Garbini, Vata, Kapha, Pitta, all conditions of Rasa, Raktavasha. have excess, try to use Pravalakapa. The textbook speaks about Pandu, Udara, Kasa, Shwasa, Gulma, and Balaroga. It is exclusively used in the conditions, especially in the pediatric, and also in the patients like gynec and obstetrics, especially in the obstetric practice. Also in the conditions of excessive menorrhagia, metrorrhagia, in all those conditions we are using Pravalagata. In the patients who are undergoing the chemotherapy and radiation also we are going for the Pravalagata. So in many of those conditions we are trying to go with that of the Pravalagata. Which is being prescribed by the textbook.
शुभ दिखाई देते हैं
all the ratnas and uparatnas as a component. And we are using by preparing the Ratnagarbha Pottali with lost all your hopes on the patient where no drug is being active. Then in those patients to prescribe the Ratnagarbha Pottali is what the textbook speaks about. So the text indicated as Mojo Vardhanam in Rajarogas, indicated in the diseases where no other medicine is working. So this is a Ratnagarbha Pottali, which is usually used in the terminal phases of many patients. It is used in emergency management in the patients who are suffering from either of these illnesses in the ICU. Almost they are next to burial ground. We try to drag them back to their houses by administering of the Ratnagarbha Pottali. Pottali is one such composition which is very commonly used in most of the clinical conditions and extensively into the clinical practice. Just because of the reason, the Palashruti of the Hemagarbha Pottali is really amazing when you read the textbook. The textbook speaks about the indications as Raja Ekma, Raktakshobha, Jeeranajwara, Ojakshaya. That's the reason why I use lots of Hemagarbha Pottali in the patients suffering from post-COVID distress. In all patients suffering from the Dhakshaya, chronicity of the illnesses, like the disorders of the Raja syndrome presentations, multiple organ failures. In these conditions, we are trying to use Pottali. The drug action, it's a combination, it's a mixed combination of all the drugs which is being used in the whole of the preparation. I try to use it in the patient. Treatment is being planned basically at 4 different levels whenever you are in front of your patient. The thing is Swastha Sarakshanam, Atho Vikara Prashamanam. The first stage, Swastha Sarakshanam, where you need to ward off the disorders by taking the Nitya Sevana as a Ratnagarbha Pottali or the following the Dinacharya and Rutucharya, wherein you follow the instructions given as per the textbook. Acharya Krishna indicated Swarna as a Nitya Sevana because it is included into the Rakshognagana. So on that group, they are using Swarna Basma as a Nitya Sevana in the form of Hemagarbha Pottali. Consuming Hemagarbha at least from past 20 years. It is being consumed as a Rasayanartha to a smaller extent. So Dushti Chikitsa, once the Shrota Dushti has happened, say for example the Pranava Shrotas as a Shwasa Chikitsa, the textbook speaks about the Palashruti as Shwasa Chikitsa. So Mallagarbha Pottali is being indicated there. So specific to that also you can plan up your treatment protocols as per the Shroto Dushti or the Dhatu Vivarnata and use it in your practice. As you see here, the Pranava Shrotas is being affected and it's been prescribed with the Mallagarbha. Similar Shrota Mula is also very important phenomenon, especially when you have the severe visitation of the doshas or the Bahudoshavastha, conditions wherever you have the deep-rootedness of the illness, wherein we are prescribing the even to the Mula of that particular Shrotas. As such, you can see, Hridaya is a Mula of the Pranava Shrotas. So try to prescribe the drug like Abragarbha Pottali, which in Shwasa patients, which is useful for treating Shwasa as well as the Hridaya, which is very effective in treating patients. Shroto Vidhalakshanas or the Vidha Chikitsa as emergency management like the Hemagarbha Pottali in the Pranava Shroto Vidha Chikitsas, which can be prescribed as an emergency medicine. So this is the various spectrum of the disorders wherever we can use a Pottali Kalpanas. We like to go with specification of the dhatu wherever it is acting. In case if it is Rasa and Raktava Shrotas being affected, most probably you can try with the choices of the Loha Garbha and Pravana Garbha Pottali. In case if it is Matsava Shrotas, try to go with Tamra Garbha, Vita Garbha and Rajata Garbha. In case if it is Medova Shrotas affected, then try with the Tala Garbha, Shila Garbha or Rajata Garbha. In case if it is Astiva Shrotas affected, try to go with the Pravana Garbha or Tamra Garbha. If it is Majjava Shrotas affected, try to go with the Malla Garbha or Rajata Garbha. If it is Shukrava Shrotas which is affected, try to go with the Tridhatu Garbha. If Ojas is affected, Hema Garbha and Ratna Garbha. So these are the various zones where you can make it as a protocol for using it in most of the patients who are suffering from your OPD practice even. You don't even need many times the IPD sector. You can treat your patients with the Pottalis with even the OPD sectors. Let us with the clinical trials. We'll try to see what are the various clinical trials wherein we can try to prescribe with various of Pottali Kalpanas. This is one such case wherein it was a pituitary macroadenoma. So what is pituitary macroadenoma? It is a variant of adenomas or the benign or non-cancerous tumors formed in the pituitary gland. So for this particular reason, the patient was suffering from infertility. When a routine investigation was being sent to the patient had the MRI brain report suggests of pituitary macroadenoma with a hemorrhagic high protein content. So for this reason, what we have cross-investigated with the blood test, where we came to know the serum cortisol was significantly low. That is the reason why the patient was not conceiving. So by administering to this particular patient with the Hemagarbha Pottali, you can see the report of the patient in the post-treatment, possibly within months. The first report is on 29/8/2017. The second report is on 20/11/2017. So possibly it's in around 3 months. You can see the serum cortisol has come back to its original within limits, by which the patient conceived eventually. So this is how we can do the benefit with the Pottali Kalpana. And for this particular patient, we have given the prescriptions like Hemagarbha Pottali, Tamragarbha Pottali with the Suzakshiri as an Anupana was being selected. Of course, even the Varunadi Kwata was also given to this particular patient. There was a case of the bicornate uterus with pregnancy with lots of complications. What is the success story which we have done? Usually people are worried whenever you say about giving the Rasaushadis in pregnancy. Sir, can we really give Rasaushadis in pregnancy? Yes, I do prescribe it in many of my patients. I do give at least Masanumasa with the 2 grams of Hemagarbha Pottali in most of my patients through pregnancy. Similarly, it happened for this particular patient where she had 2 uterus. It's a bicornate uterus there with the septum. She had a normal menstruation from one side of the uterus throughout the 9 months, whereas from the other half of the uterus, she was developing the fetus. So the size for the uterus is very large. So for this particular patient, along with the Hemagarbha 2 grams, they are also given Amragarbha Pottali with the Shastra Grutas and Anupanam throughout pregnancy, wherein the patient responded tremendously. Usually these patients go into the habitual abortions and terminate the pregnancy. But it did not happen in this particular case, wherein we could extend. I had 2 cases. I had 2 cases with the bicornate uterus, and both the cases were successful. This case had a term delivery. The second case had a delivery in almost 1 or 2 weeks ahead to the term. That's all. But almost both of them healthy and normal. So these are few of the reports of the patient. You can see that this is how the uterus look like in a bicornate uterus. This is how you can explain, especially which can be given in most of the conditions. The reports of the patient before or during the treatment or during the labor. You can see the normal patient, intra-uterine growth of the fetus in a bicornate uterus. So these are a few of the challenging cases which we can really take care by administering of these Pottali Kalpana. The other reports of the patients wherein it was being taken throughout, and this is operation how it was being operated. Of course, we don't have a choice. We have to go for LSCS and start the baby. Similarly, in the conditions like that of the arthritis, which is very common autoimmune disorder, disorder also many times, which can be named with, wherein you have RA factor positive, CRP is being raised, A.S.R is raised. So many of these complications are being observed in the patient. We find a tremendous response in the patient, especially whenever you refer them the administration of the Hemagarbha and Mallagarbha to the patient with the Dashamula Kvata or Amrutarishta as an Anupanam. The patient responds tremendously. Possibly, I have so many cases wherein we have withdrawn even the steroid dependent rheumatoid arthritis, and also for the drugs like a methotrexate and all, which are being used or being discharged by administration of the Hemagarbha, and also the drugs of these kinds like that of Mallagarbha. So slightly elevated A.S.R, RA negative, CRP is negative, but all the symptoms of RA, Amavata. So this is how the Amavata is being presented. In either of the conditions, we are not changing the prescription. You can see the response in the patient here for having a boosted CRP levels. There are various stages where we are treating. You have the Amavasta, Mallagarbha Pottali is a drug of choice. Pakvavasta, Samira Panaga Yogaraja Mishrana along with Amragarbha Pottali. Jirnavasta, Hemagarbha Pottali and Amragarbha Pottali are the choices in Amavata. In this case of a serum reactive protein which has been raised in a patient who is suffering, like you have, say it's 95 here, which is very high. These people land up into cardiac complications as well, or they might go into other complications of systemic illnesses. But it did not happen here in these cases. We have controlled them very significantly by administration of the Hemagarbha. You can see they eventually drop out of the CRP level. This is the alienated. You can see the other reports like CRP is come down to 9 here. CRP is again low, 4, within limits. So this is how you get the thing to normal. Or it can land up into complications, systemic illnesses. Even the patient might land up into a chronic illness. So this patient of CRP raised was being observed around 2 or 3 years ago. Even she visited me 2 days back, and it is fine. She doesn't have any episodes of Amavata Lakshanas. Even the CRP is within limit. RA is still negative. A.S.R is within limits. Similar other case with the ejection factor of the cardiac, which is being observed here. We can see here the patient, last line of this report of 2D echo speaks about the ejection factor is only 30%. It was being given of the Prabhakaravati and also with the Hemagarbha. The second report where you can see the ejection factor is down to 58%. The time taken is approximately 1.5 months, almost to 45 days. Wherein the ejection factor from 30 to 58% is a real improvement in the patient's cardiac functioning, which is very much in case if you are administering him with that of the Hemagarbha. So these are the advantages whenever you boost up the administering of the Pottali Kalpanas, which are life-saving drugs to the patient. So the other prescriptions which can be given in the cardiac illnesses, because many times the patients are suffering from the Raktavashrotas or the Pranavashrotas also tend to land up into Rudrogas, just because of the reason the Moola Sthana of the Rasavashrotas is Hridaya, Pranavashrotas is again Hridaya. Any of the Dhatu Kshaya happens, affected is the Ojas, again the Ojas Sthana is Hridaya. Person is having the Manovyadi, the Sthana is also Hridaya. So Hridaya becoming the Marma Sthana and also important organ, one of the 3 Marmas. It is very important to be treated with either of the Pottalis in case if you have disorders related to the cardia, like the Abragarbha, Hemagarbha, Tamragarbha, Lohagarbha, the Pravanagarbha, or few of the choices which can be prescribed to the patient who is suffering from any of the disorders of the cardiac illness. It depends on the specific type of cardiac illness. It's not like I ask you to mix up all these Pottalis and give it to the patient. Very specific to that particular condition, I do select the Pottali Kalpanas and try to prescribe them. The cases like osteoarthritis, which is very common nowadays, lifestyle disorders because of excess of intake of obesity related. As I said, where you can clearly see the sclerotic changes there in the bones, which is very well addressed with the Tamragarbha. Once you give Garbha or the next option is a Rajatagarbha, you can see the patient responding very well. You have the detotation, then Abragarbha is a drug option, especially in the senile changes. Whenever you have a patient like a menopausal syndrome, or in the conditions where you have that ability being highlighted. In those conditions, Abragarbha Pottali is a drug of choice. Like you have the osteoarthritis, wherein we specifically go with the indications of the Abragarbha Pottali, Tamragarbha or Vidhatugarbha, or few of the choices in Sandivata. Similarly, it's a case of erythrocytopenia, wherein the platelet count of the patient has dropped significantly. And I already told the disorders of the Rasa, Raktavashtotas 3 and Sukumara. Pravala Garbha is a drug of choice. So the Pravala Garbha has turned to be a bone patient where she has never seen the platelet count in her lifetime, not more than 42,000. She is now aged around 68, but since her childhood, she has never seen the platelet count, not than 40,000. So once administering the Pravala Garbha to the patient, her erythrocytopenia has been addressed, and for the first time, she has seen the reports of the platelet counter to turn to 1.2 lakh for the first time in her life at the age of 58. You can see those reports eventually. The platelet count started to build up. They started to have a good improvement. Even the general condition of the patient started to improve. The patient's condition is totally normal. This is a simple case like erythrocytopenia in a juvenile case wherein it was almost suspected to be a malignancy and they might go for a chemotherapy as well in such cases where the platelet count is totally dropped. And in those patients also the same Pravala Garbha was being given, and actually the child had very good improvement with no systemic complications, which is usually seen in erythrocytopenia. The reports of the are eventually seen. You can see the platelet count is really turned to an excellent number, and it has turned to a normal configuration. See the count; it's almost to the normal. It's more than the normal here. The platelet count, PLT. So it's turned to a very normal configuration. It's seen for the first time after 3 years of her lifespan, and she turned totally normal once for all. In the case of the cirrhosis of the liver, alcoholic liver disease, it was being possibly diagnosed as a case for the liver failure, and the case was in ICU where it was being treated. The administration of the Tamragarbha Pottali with the Kumaryasava, wherein you can see the patient before and after treatment. The cirrhosis is totally been addressed in a month's time, 1.5 month time. The liver is totally turned normal, which is a miracle to be seen from a patient in the ICU, wherein the liver is turned to be within limits. Condition which makes a person to go for a suicidal attempt is a trigeminal neuralgia. It's an autoimmune disease sometimes. Many of the time can be because of the injury, physical injury, or because of the weight. So conditions are also addressed well. I do have this patient under me even today. From past 6 years he is under my treatment, but he is totally asymptomatic and is fine. Only 3 months we have given with the Hemagarbha. Later on he was being balanced with the 3 Tamragarbha and Abragarbha. These reports of the patient, MRI of the brain in the year 2015, wherein even his cerebral atrophy was being observed, even was a side effect of the Pottali Kalpana. It has addressed the atrophy and turned to normal. Even the cerebral atrophy, the senile changes is also brought to normal in the eventual reports. You can see the diffuse atrophy in the patient in the initial day when he has come to us, wherein the patient MRI of the brain later on just totally normal. It's totally normal, and even the brain atrophy, the cerebral atrophy is addressed well by administration of the Abragarbha and Tamragarbha, and herein the patient has responded tremendously. This is a simple case to most of the practitioners, but it is very complicated to the patient. Bleeding the tongue. All the investigations were done, including the biopsy for this patient. Has tried for, she is invested in lakhs for the investigation. But of course, diagnosis, no treatment. She was always suffering from bleeding from the tongue because of the connected bleeding tongue. So what we have done, we have given to this particular patient with the Pravala Garbha, which has been applied on the tongue. whole of the ulcers on the tongue, the crackling of the tongue is being addressed, and she's totally normal. In her lifetime, it has been treated actually, or she was in allopathic medicine for past 3 years, where this situation was not at all been addressed, and she had a bleeding spot from the big cracks, which you can see from mid of the tongue. That is another complication which is very commonly seen in routine clinical practices. So in all these conditions, I am prescribing for 3 months, later on maintain the patient with that of the Tampragarbha. Many times I am preparing the Vasanta Kusuma Pottali and giving to the patient in diabetes. See the response of the patient wherein the fasting and the post-plan 331 and 373, which is significantly low with the eventual, and we are not subjecting them to the allopathic medicines. We are giving them only with Ayurvedic prescriptions and trying to maintain them with our medicines. The patient is totally normal and his sugar and everything is come to a normal configuration in an eventual process. Regular ischemia is an accidental thing which is come during the other investigations, or in case if the person is having some higher mental functions which has been altered, like might epileptic like presentation or dullness or some alteration in the CNS. In all these conditions, the boon is the Abragarbha Pottali. There is a report of a patient wherein he had a Abragarbha Pottali, which is very significantly shown its response to the patient suffering from cerebral ischemia. Administration of Abragarbha. Everything turns to normal, and even the small influx which is seen by the senile changes is also been addressed. People are worried about blood investigations by the administration of the Rasa Aushadhis. All of them are within limits. This is the case wherein he had seizures along hypoxic ischemia and encephalopathy, where Abragarbha and Hemagarbha as a combination, along with Brahmi Grita as an anupanam. The patient has been addressed when episodes of seizures is being observed for the future, and is not taking any anti-epileptic drugs, as you can see with that of the Gardiner or either of the common prescriptions which is usually given by the other practitioners. So these are the advantages what we can really give by administering most of these patients who are suffering from such dreaded illnesses. This is another case of acute myeloid leukemia, wherein the patient had a blast cells of nearly 95%. By administration of the Vishagarbha Pottali to the patient along with Hemagarbha turned out to be 0%. No blast cells seen. 0% within a short period. Conditions like the pericardial effusion and CA metastasis in the pericardium, wherein the patient had the illness with the breathlessness. See the size of the tumors in the lungs in the PET scan. There are quite huge number of lesions in the lung, along with the pericardial effusion. The pericardial effusion was being tapped by the allopathic practitioners or the surgeons, the cardiac surgeons, but the malignancy was being treated by the administration of the Hemagarbha, Mallagarbha and Sarveshwara Parpati. See the results after 6 months. 0. All the lesions have disappeared from the lungs. We had around 82 to 10 lesions in the lungs, which has been totally disappeared. There is a very small germ cell tumor with a question mark, because it's a scar mark. Actually, it's not a tumor there. It has been addressed very well by the administration of the Hemagarbha and Mallagarbha to the patient. All the reports of the 2T4, all the reports of the CT turned out to be normal. This is the case of chondrosarcoma of the sacrum in single reason, which was being treated with the Tampragarbha. These are the initial reports of the patients who before and after treatment, where the pain has been addressed along with the administration of the Tampragarbha, Abragarbha and Hemagarbha. So this is how the chondrosarcoma has been treated for this particular patient. This is another case of the CA uterus, ovary and the metastasis in the omentum, and also spread in the thyroid. The patient had a severe debility, quite young patient, had the illness throughout spread in the form of metastasis. These are the reports of the patient with obstetric and gynec history. Histopathological report says about the tumor, and also been observed like the patient had a physical presentation as well, other than the histopathological presentation. CA125 is a marker which has been done there, and it was 120 by the patient has come to us. We have treated this particular patient with Hemagarbha and Ratnagarbha Pottali, wherein the CA125, which is a marker for this particular patient, is being turned normal within limits. You can see the tumor sizes which has been regressing here, which is turning normal and normal. CA125 has come to 22.3, which is almost within limits. From 120 to 22 within a short period. Again, it has come to 11.58. Eventually, it has come to 10.95. The patient is almost in my follow-up even today. In 2020, the patient is still fine with no relaxation. So this is how you can show the response in the patient with the Pottali Kalpana. CA gastrium and metastasis. This is another case where she had a surgery and also she has taken a sitting of chemotherapy. In many of the cases, I don't advise the patient either to take a modern treatment or don't take a modern treatment. It's left to the patient. I never take that as a criteria. I ask the patient, like in case if they want to take it as a treatment, let them take it. I want Ayurvedic treatment to go with. That's it. And usually the patient responds very well, as you see in this particular case. She responded so beautifully, like the chemotherapy was being discontinued by the modern practitioners, and she started to take only Ayurveda medicines for at least another 2 years. Absolutely, the evidence of distal gastrectomy and gastrojejunostomy, no evidence of residual or recurrent lesions, no obvious evidence of metastatic disease, no visualization of the left kidney because of the agenesis. This was a genetic disorder. Other CT finding described as a totally normal. So this is how you can have a response in the patients after 2 months, not for years together. In 2 months of medication, the response in the patient being observed tremendously. Left insular space occupying lesion, astrocytoma. This was a case wherein it was being treated with the Tamragarbha. Many times a space occupying lesion where they are having a cyst around it is a very challenging to be treated because it's not very easy to break it up because it makes really lots of issues and the drug doesn't get absorbed to the area of the lesion, especially in the space occupying lesions or glioma like conditions. As you even in these conditions, the Pottalis will penetrate and try to have their response in the patient. As you can see, the response in this particular patient in the insular space occupying lesion as astrocytoma. It's a glial neoplasms. The reports of the patient. So post treatment after 3 months, the glioma stopped to develop. So it has arrested the patient is totally asymptomatic clinically. And even the evidence of this thing is totally normal. It's a reduction. So these things can definitely be done in administering to the patients. We are coming across with the cases of the COVID and the post-COVID management. In most of the patients I have an allopathic practitioner who strongly believes in Ayurveda. There are people who take lots of treatment protocols for the COVID, which have delivered lots of lectures in many webinars during the lockdown. The same prescriptions was given in the form of a Hemagarbha. Pottali was given to the most of the patients. Possibly none of the patients has met their depth nor landed up into the complication. Almost the modern practitioners have said, sir, we have given the Ayurvedic medicines and possibly 300 to 400 patients were treated and totally all of them are asymptomatic and possibly none of them were even necessary to be joined to the hospital. They were so safely handled by the administration of the Hemagarbha. Of course, there are many patients wherein we have to use even the Jaimangala and Mahalakshmi Vilas to the patient. So in that way, we have many of the drugs which can be formulated. Say, for example, you have the drugs which has been prescribed from the classical textbook, like Asadhya Roga Nashtakara, you can use Abraka and Makshika. So So therein you can go for Abragarbha Pottali or Makshika Garbha Pottali and use it in the patients. So this is a list of drugs, the reference textbook, chapter number and shloka number eventually. In case if you want the Dhatu Vivardhana, Swarna can be used as claimed by Rasaratna Samuchaya, 5th chapter, 19th shloka. So whenever you want the Dhatu Vivardhana in the patient, try to go with the administration of the Hemagarbha Pottali. Similarly, Ojavardhana, Haratala, Swarna and Panna can be given as per the textbook of Rasendra Sarasangra, Rasatarangini, Rasaratna Samuchaya or Rasatarangini. Chapter number and shloka numbers. As per the Ojavardhaka. Similarly, patients who are supposed to die, they are on the dead beds, or in the patients from the ICU, Mrityugana set of drugs can be used. You can go for the prescription to those patients with suffering with the drugs like that of Abraka, Makshika, Shilajatu, Gandhaka, Haratala, Kantaloha, Naga, Vajra. They can be given in the form of Pottalis. The advantage of the Pottali Kalpana is very specific, like that they penetrate deeper and deeper. They are quick in action. This makes it more and more potent. This makes it more and more potent, and it makes it beautifully designed in such a way like it can respond to the patient condition in a tremendous way. Pushti Vardhana, in case you would like to give the Pushti to the patient, Mauktika Shukti or Panna can be given. This is the reason for the post-COVID management I'm using Panna in my patients, like Tarksha. Tarksha is Panna. So this has been used in most of the patients. Pushtikara, we can use the Kantaloha and Shankha Basma, or the Pottalis in this form can be used in most of these patients. It's not only the Ayurveda speaks about the disorders, it has speaks about the syndromes of these kinds. Sarva Vyadihara, where you have multiple organ damage, you can go for the Pottali Nirmana with either of these drugs like Abraka, Vaikranta, Makshika, Gandhaka, Ingula, Swarna, Rajata, Kantaloha, Naga and Vajra. Or in a combination, you can prepare your own designing. You can make it tailor-made. You have any patient with multiple organ failure, try to go how it should be mixed up. And it can be prescribed to the patient based on Bala Kala Adi Apekshaya. The dosage is Bala and Kala of the patient should be ascertained. The common dosage which is given for most of the Pottalis is half to 1 rati. Normal dosage is around half to 1 rati, but certain conditions like you have the Bahudosha Vasta or some conditions like the malignancies which are really pathetic in a presentation clinically, we are trying to give them for even up to half a gram to 1 gram per day. This is a very high dosage wherein we are trying to prescribe it to the patient, but with the observation. We are keeping the patient here in the OPD as a daycare and trying to see if at all we can maintain the patient in exclusive way. And most of the time, yes, we are able to do it. Ayurveda believes in Papagna. Papa karma leads to the disorders. In that case, go for the Ratnagarbha Pottali or specifically to the Pottalis related to the Manikya Bhasma or Manikya Pishti. And Satguna Vardhana, try to administer with that of the Vajra Bhasma. The most important phenomenon in treating most of these patients is the confidence. Have a confidence in your subject, have a hold on your subject, believe in your science and administer it to the patient. You are going to get a response for sure. Only thing is you need to prepare a very genuine drug, prepare it in a proper way as per the classical textbook and prescribe it to your patient, which is very, very important phenomenon. Because gaining the confidence of the patient is very important. And this particular psychology of the patient, in case if you're unable to convince your patient, then the psychology has been affected. He will not have belief in you. The Bishop Vashya is lost. In case the psychology has been affected, then it can break you or it can make you. You can become strongly mentally or you can become mentally strong. You have a hopeless end or you can have endless hope. This attitude you have and this importance of psychology. So the counseling to the patient is also a very important phenomenon of the treatment protocol other than the drips which is being prescribed in the practice. Think positive, be positive, believe in the sign. You can definitely make wonders. This is what Acharya Nagarjuna have written to be prescribed to the most of the patient. And after all, what we need from the patient is the administration of this Pottali Kalpanas to the patient to such a way like he always smiles and says, "Thanks, doctor, for giving me this rebirth. I'm so fine today because of your efforts. of treating me. So this smile is more than a fee or more than the amount what the patient gives you. So this is what I would like to give a brief ideology about the spectrum of the Pottali Kalpanas. Thank you very much.
Excellent. Very scientific presentation. I am very grateful to Dr. M. Gopi Krishna, who has revealed the miraculous efficacy of Pottali Kalpana. Really thankful on behalf of Ayurvedic Society. Now I would like to have suggestion or any query from the audience. In audience, very learned Ayurvedic experts are here. So I would like to invite their suggestion or feedback or any experience. Otherwise, we will conclude the session here. Excellent, Dr. M. Gopi Krishna. We are really grateful. Yes, please.
बहुत ही सुंदर पहले तो मैं ताली दे रहा हूँ आपको। अद्भुत। अच्छा ये बताइए, जैसे हेमकंड पोटली वगैरह अगर किसी को कोई दवा चाहिए तो क्या उस दवाई का सप्लाई कर सकते हैं?
सर मेरा कोई फार्मेसी तो नहीं है, मैं तो सिर्फ क्लिनिक चलाता हूँ।
नहीं क्लिनिक के लिए मेरे को भी क्लिनिक के लिए
मैं दे सकता हूँ।
हाँ क्लिनिक के लिए चाहिए मेरे को।
जी क्योंकि मेरा कोई फार्मेसी नहीं है, मैं सिर्फ क्लिनिक चलाता हूँ और मेरे क्लिनिक के लिए मैं खुद बनाता हूँ।
हाँ तो क्लिनिक के लिए चाहिए मेरे को भी, व्यापार के लिए नहीं चाहिए।
बिल्कुल।
और लेकिन आपका प्रेजेंटेशन बहुत ही सुंदर लगा। मैंने पूरे मन से इसका सुना है आपका, बहुत अच्छा लगा। आपको बहुत बहुत धन्यवाद करता हूँ, साधुवाद देता हूँ।
थैंक यू सर, थैंक यू वेरी मच।
थैंक यू।
Any other learned expert, please? Really very nicely explained. Hello, Shivappa ji.
Sir.
Dr. Vikram Shivappa ji.
Yes, sir. Tell me, please.
It is very nicely explained
Yes,
with
sir.
scientific evidences. So
Yeah.
I hope there is no question or query from anybody.
Yeah. And
Very nicely explained.
Sir has not given any chance to ask. Actually, he has explained in such a way, even layman can understand the things properly. And as he is a real practitioner, and he has translated so many books which were there in Sanskrit, so he I think he has drinked all the Amrita which is there in Shastra through these books, and now he is distributing it to the patients. Amrita Kalasha Astaya, isn't it? That words goods to our Gopi Krishna sir.
Yes, definitely.
भगवान हमारा
I would like to request
पूरा शिव जी ने, हमारा भगवान शिव जी ने पूरा पुट्टली के रूप में उसको वर दिया है सर।
वरदान दिया है। He has direct Lord Shiva's blessings.
Yeah, 100%.
At the conclusion, I would like to request Professor Shankar Sharma ji. He has also joined through Vivek's again. Gurudev, are you able to listen me? Am I audible to you? I hope he is not here. So, very nice session. Everybody has learned, not only me, really. And I am very much grateful to Dr. M. Gopi Krishna, who has faith on this Pottali Chikitsa and who has experienced so much practical knowledge. Really grateful, really grateful.
Thank you, sir. Thank you very much.
Thank you, Dr. M. Gopi Krishna ji. We will be meeting again, definitely. I will trouble you again also. Thank you.
It's my pleasure.
So nice of you. So nice.
Thank you so much. Thank you so much to you all.
Thank you very much.
Hari Om, Hari Om, Hari Om. Thank you all. Thank you all for participating. Thank you very much.
Sir.
Hari Om. Hari Om.